pressure is mounting this morning on the federal government to do more to help the aged care sector, with providers estimating that a quarter of all care shifts are going unfilled. A new report from the peak body Aged and Community Services Australia is sounding the alarm as the deadly Omicron wave continues to spread through Australia's nursing homes.
About half of Australia's aged care facilities are battling COVID-19 outbreaks, and the federal government says 566 residents have died from the virus this year. That surpasses the entire death toll for 2021. Let's go straight to Noor Haider at Parliament House. Noor, how extensive are these staff shortages?
Well, Lisa, aged care providers estimate that a quarter of shifts are going unfulfilled. That's equivalent to about 140,000 shifts a week. Now, peak groups representing the sector are calling on the government for urgent support as they face these ongoing staff shortages and a lack of some crucial resources, including access to rapid antigen tests and PPE equipment. Now, Australian Aged Care Collaboration, that's a group of 6 of the main aged care providers across the country, including Anglicare, Baptist Care and Uniting Care. They represent about 70% of aged care providers in Australia, and they've criticised the federal government's aged care bonus payments announced earlier this week, arguing that many aged care staff will be excluded from receiving those incentive payments, including staff who work in maintenance, reception and lifestyle programs within aged care facilities. Now, the federal government is also facing pressure from the opposition to support a case that's currently before the Fair Work Commission to increase the wages of workers within the sector. The federal government has to date so far, been reluctant to do so. Now, the sector is calling for a number of urgent measures, including appropriate payments for aged care workers to reflect the increased risk posed by COVID-19 within the sector. They say that better surge workforce arrangements are also needed to ensure adequate care is provided, not just during this outbreak, but future COVID outbreaks. And they say reliable supplies and distribution of rapid antigen tests and PPE equipment is required. We heard earlier this morning from the CEO of Leading Age Services, Paul Sadler. This is what he had to say.
We have a crisis. It is absolutely a crisis out there. As Michael mentioned, we've had 25% of all our shifts across residential care and home care unable to be filled due to people either having COVID or having to be isolated because they're close contacts. In that context, we're seeing immense challenges in actually what we can do to help older people. We're seeing in residential care situations where we have to reduce the number of showers people are having, prioritise basic care like getting food to people over leisure and lifestyle.
No, the federal government's defended its response.
Yeah, the federal government has been defending the level of support that it's provided to the aged care sector during the pandemic. Yesterday, we heard from the Aged Care Services Minister, Richard Colbeck, who was appearing before a parliamentary inquiry, and he said that the sector is performing, quote, extremely well, despite the difficulties posed by the Omicron wave. Now, as you mentioned, 499 aged care residents have died in January of this year. That's more than all of the deaths in aged care during 2021. Now, while appearing before this parliamentary committee, Minister Colbeck also defended his decision to go to the cricket instead of attending a previous inquiry into COVID-19. He said he does hold the dual portfolios of sport and aged care services, and he said that while at the test match he continued to work on the matters relating to aged care. Here's a little of what he had to say to the committee in defending the government's support for the aged care sector.
My view, and the data actually supports that, is that the sector is performing and has performed exceptionally well in the work that it's doing. I think it's very, very difficult. The workforce is extremely tight, particularly because of the transmissibility of Omicron and the impact that that's had on the availability of workforce.
Now, this morning we heard from the Health Minister, Greg Hunt. He's rejected suggestions that Minister Colbeck should be booted from the portfolio. Greg Hunt has acknowledged that the sector is facing what he described as immense challenges, but said that the federal government has provided millions of units of PPE equipment and support with shifts, and that in Australia the aged care sector has seen less deaths than other nations. Lisa?
Noor, thank you.